Assalamu alaikum. From the continuation of the previous video, the urinary antiseptic. Urinary antiseptic are specifically made for the urinary tract or the oral agent that exert antibacterial activity in the urine, but no systemic antibacterial effects. Their usefulness is limited to the lower urinary tract infection. And why urinary septic and not the urinary antibiotic? I use the word urinary antibiotic. Why I'm not using this word? Tell me your answer in the comments. Drug used as a urinary antiseptic are nitrofurantoin, methamine, and the nalidic acid. Nitrofurantoin is a bacteriostatic activity limited to the E. coli. Mechanism of action: sensitive bacteria reduce the drug to an active agent that inhibit the various enzymes, damage bacterial DNA. Antibacterial concentration is not attained in the blood or the tissue, so not to be used with the proben acid. Azithromycin patient. Azithromycin is basically the patient. Azotamic is a patient having the excess of the nitrogen concentration. It interferes with the tubular secretion of the drug. Nitrofurantoin adverse effects include GI intolerance, nausea, epigastric pain, diarrhea, hypersensitivity reaction, peripheral neuritis, and other neurological effects with the long-term use. Hematological disorder include all these as I described previously in the topic of the sulfonamide. Liver damage, pulmonary reaction with the fibrosis on the chronic use. So it is contraindicated in the renal impairment because it is renally eliminated out and it crosses the placenta. So it is contraindicated in the pregnancy and in neonates. Nitrofurantoin adverse effect as I described previously. Its use is treatment for the uncomplicated lower UTI not associated with prostatitis. As you can see in the topic of the treatment of lower UTI or the complicated or the uncomplicated UTI, supportive long-term therapy, long-term prophylaxis following catheterization, instrumentation in the women with a recurrent cystitis. Methamine, hexamine. Methamine is a prodrug with the mechanism of action. It slowly decomposes in the acidic urine to release the formaldehyde. This formaldehyde inhibits the all bacteria. No antimicrobial activity in the blood and the tissues. Need to administer with the mandelic acid or the hippuric acid. As the methamine mandolate used in the chronic and the resistant UTI not involving the kidney. Not effective for the acute UTI catheter prophylaxis. Its side effects include gastritis, chemical cystitis, hematuria, that is a urine, bloody urine, occasional CNS symptoms. Nalidic acid is the non-fluorinated quinone with the same mechanism of action as that of the fluoroquinones. You can see in the previous video of the topic of fluoroquinone. Nalidic acid used, second line drug for the UTI. Recurrent cases on the basis of the severity report. ADR infrequent, that is GI upset or the gastrointestinal effect. Rashes, headache, drowsiness, vertigo, visual disturbance, seizures in the children, nausea, vomiting, and the abdominal pain. Photosensitivity. With these symptoms, you can seize this drug. And contraindicated in infants. Phenazopyridine, this is a new drug. Urinary analgesic. Afford symptomatic relief from the burning maturation, that is a painful urine. Dysuria, no urine, urgency, no antibacterial properties. Side effects include nausea and epigastric pain. Treatment: urinary tract infection. Treatment: most gram-negative organism, acute episode, single organism, chronic and recurrent, mixed infection, largely self-limiting because it is limited without any the treatment of the or any medication. High urine flow rate, frequent bladder voiding. Lower urinary tract infection, single dose antibiotic or the 3-day course is sufficient. Or for the upper, longer treatment is required. You can differentiate the treatment of the lower and the upper UTI infection. Urinary tract infection treatment, bacterial investigation very important, smaller than usual dose required for the treatment of the lower UTI because it is less complicated than the upper. For the upper, longer treatment is required as I described in the previous slides. Normal dose as for any other infection, least toxic and the cheaper drug should be chosen. Perineal flora and drug should not disturb the normal gut and the perineal flora. Frequent recurrence chances is seen in this condition. Chronic suppressive treatment with the CO-TRIMAXOLE, nitrofurantoin, methamine, cephalexin and the norfloxacin are prescribed in the clinical setting or the mostly seen in the clinical setting. Status of the antimicrobial agent other than urinary antiseptic. These are basically the clinical points. As a clinical pharmacist, you should know about these points. What is the status of the antimicrobial agent? Sulfonamide, decreased dependability for acute UTI, not used as a single drug, apply for the suppressive or the prophylactic therapy, CO-TRIMAXOLE, declined responsiveness, prophylaxis for the recurrent cystitis in the woman and the catheterized patient. Quinone, first generation quinone, that is norfloxacin and the ciprofloxacin is the mostly used. Ampicillin and amoxicillin frequently used in the past, higher failure and the relapse rate. Cephalosporin, increasingly used especially in the nosocomial, that is in hospital acquired epilepsy and the proteus infection. Employ on the basis of the sensitivity report, that it is CS culture sensitivity report. Employ for the community acquired infection as well as cephalexin. Alternate choice for the prophylaxis of the recurrent UTI, especially women likely to get pregnant. That means that are expected to conceiving. Gentamicin, sensitive against Pseudomonas, narrow margin of sensitivity, parenteral administration is suggested. Bacterial sensitivity awaited, that means it is prescribed after the CS. Urinary pH and the antimicrobial agents, acidic urine required for methamine, inadequate response in the complicated cases, measurement and the correction of the urinary pH may be attempted. Urase positive is basically the test for the identification. It is a microbiological test. Drug acting at the higher pH should be administered. Favorable urinary pH for the antimicrobial action like acidic alkaline pH. Nitrofurantoin, clotrimazole, chloramphenicol, methamine, amino glycoside, ampicillin, cloxacillin, and these are the drugs which are used in the above condition. Urinary infection. In patient with the renal impairment, it is difficult to treat because all urinary drugs or the specific most of the drugs are eliminated renally. So in the case of the renal impairment, the drug is not eliminated, so it is the most difficult condition in the clinical setting for the clinical pharmacist to choose the drug wisely. So the drug is difficult to choose. Contraindicated, methamine, mandolate, tetracycline, cephalosporin, some drugs avoided. Nitrofurantoin, nalidic acid, amino glycoside, not prescribed. These all drugs not given to the patient of the urinary infection with the renal impairment because it can worsen the condition. Potassium salts and the acidifying agents are contraindicated. Then these are the summarized sulfonamides point. Basic characteristic of the sulfur, that is itself sulfur mnemonic. S, solubility low, useful for the urinary tract. L, large spectrum against gram-positive and the gram-negative bacteria. F, folic acid synthesis blocker, dihydropeptidase synthesis, dihydrotrotid synthesis inhibitor, antimetabolite, and analog of the PABA. Side effect of the sulfonamide include, remember the word sulfur, that is Asger syndrome, skin rashes, urticaria, urine precipitation, that is a crystalluria, stones in kidney, leukopenia, decrease or the low count of the leukocytes, folic acid deficiency, and the aplastic anemia. The reasons of these side effects I describe in the video. Thank you so much. Thanks for watching.